As far as side effects, I really didn't have any. I think my energy was down some, but not a lot. And it was about a month after treatment, back like I always was. Work out for an hour every day, 2 days at the gym, 5 days at the track. And I think maybe better energy than before the treatment.
I had absolutely no side effects. However, Dr. Kim was very good about alerting me to side effects. You know, told me to call if you feel this or if you feel that or anything. It was really nothing different than the effects before. I mean, urgency, frequency. Yeah, I still get up in the middle of the night, but to go to the bathroom. But I was doing that before I came here. So beyond, you know, just the daily routine and knowing that you can't travel or something like that. It's nothing but positive.
Side effects. When I had my first consultation with Dr. Kim, he, after explaining all the various treatment options that were available to me, because I was so fortunate in my early diagnosis and the stage of the progression of the disease. Once we decided on a pathway, he was there to discuss the possible outcomes. And certainly, you know, you're looking for a cure, but always at the top of the list when you're talking about outcome, you have to talk about side effects. And Dr. Kim gave me a printed out list and some reference material on side effects of radiation therapy. And the data on SBRT is a little light only because it's just not been around very long. But he was able to walk me through and say, these are the things that we expect. I'll have to say that for the first 10 days after my last treatment on the 26th of December, I wondered if anything had really happened because I felt fine. There were no side effects whatsoever. But then, at about the 10-day, 2-week point, just as Dr. Kim had said, I began to notice side effects. And the side effects I noticed were precisely the ones that he said I would probably experience. I had nothing more, nothing less, no more severe than anything he said, or less severe. I was, as a matter of fact, I was so moved by the fact that the side effects I was experiencing were so in line with what he had told me about. I called him from Maui and said, these things are happening. I'm not being surprised. Do I need to be doing anything? And he prescribed one medication to ease some urinary problems because of the inflammation there, which I took for about 2 days. And then after about 10 days, the side effects just started falling off the table and life returned to normal. So you know, by way of kudos to the team here, they seem to have identified the most likely side effects, and they are very open in discussing these with prospective patients. And then, you know, for a patient that's been through the process now, to have seen those side effects and nothing at all debilitating, to see them unfold exactly as the doctor had predicted and the technicians had predicted, was pretty reassuring to me that the people here at this oncology center really knew what they were doing, and the process that they were using, the procedure, the SBRT procedure, was second to none.